organizations, to attend some of the events, and really, see it from a different light once you attend some of those things. So, without further ado, I just want to keep this moving along. I'm going to invite our health panelists to come up to the stage, please. I'll start with our moderator. Our moderator is Richard Chamberlain. He is an epidemiologist and registered sanitarian employed by the City of Laredo Health Department for the past 4 years. His educational background includes a Bachelor of Science in Biology from Texas A&M International University and a Master of Public Health from Capella University. Richard is currently a Doctor of Public Health candidate at Capella University and will complete his doctoral degree in 2019. Richard believes using the power of epidemiology to improve the public's health is a vital tool for the prevention and control. Richard will dedicate his professional life to a lengthy public health career, taking in as many opportunities to ensure knowledge and good health for the communities he serves, such as the hackathon. Thank you.
Thank you so much for the introduction, Roger, and thank you to Mile One for having us here. I'm going to go ahead and give a little introduction about our panelists. So first we have Dr. Waldo Lopez. He has 42 years experience in public health, 22 years as a preventative medicine specialist in the U.S. Army. He has lived in areas of the United States, North Carolina, Texas, Georgia, overseas, Italy, Germany, Central America, Puerto Rico. He does hold a PhD, a Master of Public Health, and is also a registered sanitarian. He has 15 medal awards and decorations from the U.S. Army. He is a humanitarian SVC. He does also host a humanitarian SVC medal. He is a member of the Delta Omega Public Health Honor Society. He is a preventative medicine specialist, an environmentalist, an epidemiologist, an industrial hygienist, a lead risk assessor, and a past member of the United States Air Force Civil Air Panel. He is also a licensed air pilot. We also have Ms. Kayla Castillo. She has worked as a medical technologist at clinical laboratories for 15 years. She did finish her Master's of Public Health from Texas A&M University and has joined the City of Laredo Public Health Emergency Preparedness and Epidemiology Department as a supervisor. After 10 years at the City of Laredo Health, she joined the Center for Disease Control and Prevention as part of the response to the Zika virus outbreak assigned to the City of Laredo Health Department. So thank you all for being here, and once again, thank you all for hosting us. So I wanted to go ahead and get started with sharing a little bit about our current state of health here in Laredo. So I wanted to share some facts about the top 10 infectious diseases Laredo had for 2017. So for 2017, the top 10 infectious diseases do include chlamydia, which would be first, syphilis, streptococcus, group A, B, and pneumoniae, tuberculosis, carbapenem-resistant enterobacteriaceae, which are multi-drug-resistant organisms, salmonella, gonorrhea, HIV, campylobacter, and typhus. So knowing that, there are complications that do arise from those infectious diseases and as well as from our chronic diseases. And I would like to ask the panel, Dr. Lopez and Ms. Kalo, access to healthcare plays a significant role in the health of individuals. What suggestions do you have to achieve a sufficient medical provider to patient ratio?
First, it's really a pleasure to be with you tonight. I feel like I'm in the late night show. Since we're not really at first and the sun went down and it's dark outside. And our sugar levels are going down. So I really appreciate being with you a whole lot. I really appreciate being in Laredo for the past 20 years. And for the access to care, we have seen a tremendous variant in our community as opposed to like 20 years ago in what we state nowadays. We've seen people that are still, although we have Obamacare and we have Medicaid, Medicare, CHIP, Medicaid, CHIP programs and other programs that assist with financing healthcare services, we still have a population in our community that, although 20 years ago it was like 40%, and now it's like 34% of people who are uninsured or don't know how to access care, just not having the knowledge, and also people that are not sufficiently insured, that spend a lot of monies into the copay in the system. So we're doing better, but we still have a lot of room for improvement. So I'm really proud to be part of this community, because this is a community that continuously keep growing, but it also keep being transformed as the years go by. So this is a community to be proud of. I speak 4 languages, and I'm really proud that I speak Spanish first, as one thing that was mentioned over here before. So in part of the question, moderator, can you enlighten me again one more time?
What suggestions do you have to achieve a sufficient medical provider to patient ratio? Since we do know a lot of our Laredo patients outsource medical providers.
The background here is we're gathering data from HRSA, and according to the HRSA data files and statistics, in Laredo, for every 1,000 people, there's 1 physician. And for every 5,000 people, there's a specialist. And what are the factors that are making physicians not stay here once they graduate, or if they're from Laredo, not coming back to Laredo? We're looking at all of those factors. We have been designated by HRSA as a HIPSA shortage area, a health care professions shortage area, which is good and which is bad too. Which is bad because we don't have enough providers, and it's known knowledge that is common knowledge nationwide. But also it's good because we're a HIPSA shortage area. We have also incentives to bring physicians and nurses and specialists to Laredo, because through the HIPSA program, we can help them pay back their expensive education. So for example, the health department is a HIPSA designated site where we can help the healthcare professionals pay back their significant loan that they bring with them when they start practicing. So that's one of the incentives that we get by having a shortage of healthcare professionals in our community, which we're working with. Another thing is the Medicaid rates. Medicaid rates in the city of Laredo, for physicians that do get Medicaid reimbursement, they get a little bit less when you're in Laredo than you would get into highly density populated areas like Houston, San Antonio, and so forth. So they go by population density and health care access to a lot of people. So these are some of the things that are determined, but we have seen a little bit of an increase, and I think we're doing better, but still we have a lot of improvement to go. Back when the Viva Laredo Planning Committee was meeting, there was some areas that the Planning Committee identified, and one of them was exercise, nutrition, psychological and emotional well-being, lifestyle behaviors and habits, genetics, environmental risk factors, access to care, and of course the overall health of the community. Our mission right now is to better your health, the quality of your health, as well as the quantity of health of years ahead of you. So this is really a little bit complex. It's not something like we can address only by bettering technology or bettering access to immunizations. This is a little bit, the level of complexity is a little bit higher than just the basics.
Thank you for that, Dr. Lopez. Ms. Kayla, just to build off of that, of course, what suggestions do you have to achieve a sufficient medical provider to patient ratio? Which methods for recruiting and retaining medical providers are needed when collaborating with private, nonprofit, and other government entities?
Well, I think I agree with what Dr. Lopez explained earlier, but I think it is a complicated issue, but there's some potential at least start the improvement of access to healthcare. We have a college, Texas A&M, we have Laredo Community College, and then we have a campus for UT Health Science Center. Those are areas that we can start to build. We can raise awareness that they're here, the programs that they have here, and hopefully more programs can be added as far as healthcare professionals. I know because we've researched when we were trying to study the master's program, and we were inquiring about the physician assistant program, the laboratory sciences. Those are programs that there were some interest here in the past, not enough for the colleges to bring a full cohort, but that's something that can be built upon. Spreading the word, raising awareness, going to the career days at the schools and letting students know what other professions are here in healthcare. We need them. We need those professions here. And that, raising the awareness for those areas, probably the colleges would then have enough students to build those cohorts and to bring those professions here. As far as access to healthcare, another issue that I think we should consider is the culture in this area, in this city. We say a lot about that we don't have enough specialties, that we don't have enough doctors, but then we have to consider that many of the people that live here in Laredo, they go across for services. So they are receiving services, they are looking for specialists, not here in Laredo, but in Nuevo Laredo or Monterrey. But this is our reality. We have, it's a whole community, it's not just one city. That's our way of life, and that's what we deal with in healthcare.
Thank you for that. And to add on a little bit more in regards to recruiting and retention, I know that many other cities do have health districts and biomedical areas of the city that could potentially help impact the economy of Laredo if we did develop that type of district here in Laredo. So I'd like to ask the panelists, how does public health engage the philanthropic and private sector to develop and sustain the expansion of the healthcare industry and develop a biomedical hub hospital district?
First, I think we have to understand what is a biomedical hub system and what is a hospital district. In Laredo, we have 3 hospitals, basically. One is doctors, LMC, and specialty hospital. And we have a lot of clinics. And the common health condition that we are addressing, in addition to a multiple of things, it's, of course, diabetes, hypertension, and obesity. It's not the same as when you have like HIV, but also having diabetes, obesity, and hypertension. And if you know your BMI, you kind of have got an idea of what you need to work on. So these are some of the things that we're working with within the city of Laredo. The city of Laredo has this infrastructure, and there's some cost reimbursement to the hospitals through the Medicaid 1115 waiver, for example. They call that uncompensated care. And through the Medicaid 1115 waiver, the hospitals can recuperate some of the costs that is incurred by people going to the emergency room, for example, unannounced and by surprise, in receiving the services, because by EMTALA, which is a law that we have nationwide, any hospital that you go to, they have to see you, whether you have insurance or not. And if the service that they have for you, it's not enough, or it exceeds their capacity, then by EMTALA, the Emergency Medical Act that we have, they have to refer you to the facility that can take care of you. Hospital district is a hospital that is funded by the state of Texas. And the hospital district takes care of all of the people that don't have enough insurance or don't lack of insurance or has any funding issue with the healthcare service. So there, everyone is seen, whether you have money or don't have money, whether you have insurance, not enough insurance. So we're talking about a county hospital. This is something that the city and the county would have to embrace. The proposal right now into the future will be that Webb County will impose a small fee in order to fund a hospital district. And then the hospital district will be like Parkland in Dallas, in San Antonio, the UT system that provides services to the indigent, medically indigent population. So this is something that we are already working with, that our county judge and our city mayor has already met several times on, that our hospitals have met on, and surprisingly, the hospital don't mind a little bit of what in some communities is perceived as competition, because it's driving away people that can pay, or people that don't have enough. But the hospitals are seeing it like, this is the uncompensated care. Instead of coming here, we provide the service and we don't get compensated for. They go to hospital district. They get taken care of, and it's savings to us. So not both, the three hospitals have embraced that, surprisingly. And in some communities, it has been a struggle. But that's a very good question.
Ms. Kayla, would you like to answer?
Well, I just think it's a good opportunity to build upon the shortage of medical professionals, because that could be an opportunity for a residence program. So bringing more attraction to the medical students and hopefully them staying here for a while to practice here.
Thank you. So I wanted to move on to laboratory capacity. The city of Laredo, I don't know if many do know, we do host a BSL, a biosafety level 3 lab that is on the verge of acquiring an accreditation from the Department of State Health Services, Texas, which would fully accredit the city of Laredo Health Department laboratory as part of the laboratory response network. And that being that we would be able to acquire that accreditation, that laboratory response network would provide several benefits for the local community. So what I would like to ask is, new and emerging diseases are consistently finding ways to circumnavigate the globe. In our recent past, we have had news of viruses such as Ebola, chikungunya, and Zika become part of our household conversations. Currently, the Laredo Health Department is on the verge of becoming part of the Laboratory Response Network. Why is this accreditation, known as the LRN, at the City of Laredo Health Department significant for local, regional, and international disease control? Ms. Kayla?
I think Kayla can take a first crack at that one, because she was in the lab area before. She's a microbiologist and epidemiologist, so she can start with that.
Well, yeah, I can start, definitely. It is critical because that is on the forefront to fighting any type of outbreak, any type of infectious disease that is incoming. Our position here in Laredo, it's critical. Our nearest LRN laboratory with that same designation is in San Antonio. So it's 2 hours away from us. We've had instances where we need a specimen to be tested, and we definitely have to put it in a car and then drive to San Antonio, because that's the need, and that's the only place where we can send that sample and they can accept it and test it. We need that here. We definitely can make a difference. Also, we can be as a reference to cities around us, to other neighborhoods that they need the same capacity. One thing that is critical for our area, it's the business, all the traffic, all the movement of people and parts and chemical substances that go through our city. that is critical for us, and we need to be ready to respond to any type of emergency if we have one. So that laboratory could help us in many different ways to be ready, to be able to respond, to know what we're dealing with, and to definitely provide results to lawmakers, to the city mayor, to county judge, to take action and to make decisions on the spot.
Great. I really like Kayla's background. I'm going to add a little bit to that background as to how we became a BSL-3 level in a bioterrorism lab is really what it is. It's how it began being. Right around the year 2004, 2006, in that year range, is when we began constructing the BSL-3 that is a $2.5 million value. I know that most of you here will remember, or maybe your parents would have shared with you about the Twin Towers going down in New York. I'm sure that all of you have heard about that, about the 911. And that was a terrorist kind of act. It has been unforgettable. Right after that, the country experienced some anthrax exposure. Anthrax is like a bacterium that has spores, has the ability to grow spores. And when it's inhaled and invades your respiratory system, it can be very devastating for anyone that is exposed to anthrax, actually. And if it's weaponized, it can float in the air and even go miles away from the discharge of anthrax. So the post office in Pennsylvania and post office in the northern areas were sent anthrax powder. And some people died from the exposure to anthrax. And so shortly after that, the system began reinforcing, the CDC public health system nationwide began reinforcing their capacity to detect. And Laredo was no exception. We jumped in that bandwagon, and right away as the train is passing by is the time that you jump in the train. You don't let the train go by. When you see an opportunity for Laredo, you need to grab that opportunity and bring it to Laredo. And we did that, exactly just that. We grabbed that opportunity. We got the funding. Senator Zaffarini was part of it too, and she was there in the inauguration day. So that's when, a couple of years after, we had finished completing constructing the BSL-3. The BSL-3, it started with this bioterrorism approach, but then it became, a vision of a lab that can test just about almost anything that there is, that can do DNA, PCR, and other testing that had not traditionally been done here in Laredo, stuff that had to be sent out for other labs to test. So here in the health department, as little or as basic as it may be perceived to be, it has some special features. When I first got here 20 years ago, the health department provided, yes, the basic services, but now we're detecting things like our weapons of mass destruction, such as tularemia, bubonic plague, anthrax, and stuff like that. We have that capacity. We have a negative pressure, triple negative pressure contained environment that we can work on that has a sophisticated ventilation system to make sure that what we are working with is not releasing to the environment, because just 1 ounce of anthrax can expose a lot of people downrange. So we have that capacity. Right now, we're working with Texas Tech and the universities through a Bill Gates, Melinda Gates and Bill Gates Foundation to have this, exploit this into a binational service or detection or surveillance, laboratory surveillance system that together with the binational epidemiology program can provide more, not only to the U.S., because if we can stop diseases at the border, they're not an issue to the state of Texas in the nation. So CDC in the nation has seen value in Laredo because we have things that can detect early right here at the border before it becomes inland. So, you know, just like Laredo is like the #1 inland port, it could be the #1 strategic biological hub for the Americas. So Laredo has gone a long ways. We are on the map. We're everywhere. We've been to CDC. We've been to NIH. We went to DC. We've been to a lot of places, universities, you know, even in California. So Laredo is known in public health, is known nationwide. You know, I have to go to a forum in Florida the next month about Zika and what is Laredo's best practices to detect, to do surveillance, to control, and to prevent Zika. Laredo is known by the nation as a model city by CDC. Thanks.
And just to add a little bit of more on that, as they were both mentioning, Laredo is a corridor to the United States that does have an influx of traffic going north and going south, and a lot of illegal entry to the country as well, that we do need to have that type of capacity for our city to be able to detect and control and prevent the spread of any type of infectious disease. I know just as recently as 2015, we did have a coyote that did test positive for Yersinia pestis, which is the microbe that does cause bubonic plague. So we do have that here in Webb County. It could be in your backyard. But if somebody was exposed to that bacteria and we have to send out that laboratory specimen and wait for the turnaround time, when we could do that here and have that capacity, that is the more of the significance that the laboratory response network would bring to Laredo. So I'm going to go ahead and move on from the infectious disease to chronic. So chronic diseases, I wanted to share about, as we all know, that Webb County does have issues because, due to our Hispanic heritage with obesity and diabetes. Webb County obesity prevalence is 35.7%. 63.8% of adult males and 61% of adult females are at risk for obesity in Webb County. The incidence of diabetes for Latinos in the United States is at 12.8% compared to the general population, whose rate is at 9.3%. Obesity and diabetes are of major concern for our local population. What needs to be initiated to inspire research, develop policies and programs that will increase food security, improve health outcomes, and create social and economic opportunities to attempt to ensure that every resident has access to fresh, healthy, and affordable food.
All right. When Kayla is silent, it's time for me to go again. Okay. Well, let me tell you what we're proud of right now. I'm so proud of Laredo. I'm part of Laredo. I was not born in Laredo, but I've been here 20 and a half years. So I am from Laredo now. I drank plenty of water from the river, and I keep drinking, and it tastes better and better every day. So looking at the obesity.
To reinstate that, what needs to be initiated to inspire research policies and programs for obesity and diabetes prevention and control?
And right now, our city mayor has this thing called the Mayor's Active Living Council. And some of you who are very much into the internet and into Facebook, social media, you would see the health department it's everywhere actually. And then if you go to the city's webpage, you're going to find that link that tells you a little bit about the Mayor's Active Living Council. You're also going to look at some of the things that Laredo has been doing in the past few years, which is making more community gardens and teaching more on nutrition. And Laredo has a farmer's market. I was going to say flea market, but a farmer's market. And Laredo has done a lot to increase the knowledge of what we eat and what is healthy for you. Laredo has done a lot for bringing groups of people. I see them in their bikes on Saturday mornings as I go to the Super HEB and I go back to my home. I see a squadron of bikes with their helmets, bikers, traveling with a lot of enthusiasm. And I see a lot of people at the parks that are jogging, you know, and we have over 90 parks right now. Did any of you knew that? That's a lot of parks for a small city, right, as compared to Houston or Dallas. So I think Laredo has made great strides into improving the health of the community. I think we're more health conscious, but we still have a certain percentile of our community, it's significant still a little bit, we're doing better, that still needs to learn how to appreciate the value of eating more vegetables and greens, you know, and, you know, maybe having your own garden in your backyard, growing your own tomatoes and lettuce, carrots, you know, and so on, that you can, you know, maybe, you know, from your own place, you can do that. We need to learn a lot about, you know, how to deal with our agriculture here in Laredo. What is the composition of our land? You know, what is it composed of? When I was working with Dr. Donnelly, who passed away, he was a Texas A&M toxicologist. We did a study of in El Cenizo and Rio Bravo, and we were studying pesticide exposure. And that's how I learned that Laredo in the past was agricultural, because of looking into the history. You know, there was a lot of crop growing here, and a lot of stuff growing. I think he knows, right? You remember. And because of that, they were controlling the insects and the pest products, the insects that infest the crops in the gardens and stuff like that. And they applied stuff like DDT that has a half-life of 50 years and a full life of 100 years. So in this study with Texas A&M, we found that children nowadays, and we were getting pieces of their hair, maybe inside their gum, and testing them in the lab, we found that some of the children today had DDT in their bodies, and that was linked to diabetes, and that the rate of excretion from Hispanic was less than the rate of excretion from an Anglo. You know, so we found a lot of interesting factors that we had to learn with this study. So, you know, I think we need to do better with, now we have what we call the Laredo Food Council. Recently, we had a very interactive seminar provided by Mark Winnie from California at the health department. And some of you are nodding your head that you probably were there. And we learned a lot from this person, who seems to be, you know, specialized in this field. And some of the things that he found is that Laredo already is doing a lot of stuff. We're doing a lot of stuff in Laredo individually. But what we need nowadays is to integrate what we're doing. You know, we need to integrate. We need to integrate, you know, like how to address the food desert that we have. Through all of these venues together, and by sharing this, and, you know, integrating, and we can become more powerful and more meaningful. So that's some of the things that we have found through the Food Council. In the area of health, for example, there's a lot of vision. Two years ago, Medicaid came with this rule that now we have to have electronic health records. So all of the physicians were jumping through the hoops in Laredo because they wanted to get reimbursed for Medicaid, and they didn't have electronic health records. So they started finding out, right, doctor, that if they did that, if they had an electronic health record, they would still stay in with the flow and meet all of the requirements. Now, the vision is not only having electronic health records, the vision is by having electronic health records that are read anywhere you go, total integration. So the Valley started working on that. So Laredo, now we're part of that too. We want you, if you go to LMC or if you go to Doctor's Hospital, Specialty Hospital, Gateway, or the health department, we would have access to your medical history Anywhere you go, if you're working at Gateway, we can view everything that was done at, over there at the health department, or if you go to LMC. That is called total integration. So we're looking at that in the future, and that's work in progress. You know, so we want people to make their own appointments, just like in LabCorp. You know, you want an appointment with primary care, with Gateway or the health department, make your own appointment. What is the best day for you? This is the availability. You know, we want people to have access to your laboratory results and all of that. These are things that we're work in process, and I think we're going to get there soon.
All right, are we still good on time?
Okay.
Did you want to comment on that?
Just a quick reference that in talking about the healthy eating and what the community has, I want to reference the previous panel where they said that there's a lot of things happening here in Laredo and people just don't know about it. Same thing with healthy eating. There's a lot of instructions. There's a lot of groups that are out there to teach the people how to eat healthy, what to eat in restaurants, how to just be healthier. It's just that the word needs to get out. People need to know about it already.
All right, so I guess we'll move on to some Q&A. Any questions regarding health? Right back there.
Can you keep things easy too?
Well, two things. One of them I just read recently about the use of aluminum in heating for our food, and that has a direct link to Alzheimer's or these type of diseases. Is there any education going on around here? Because a lot of us, not along the border, use a lot of aluminum pans for cooking. That's...
I haven't read anything about that. I would definitely have to research about it. And when it's something that it's confirmed and that it's proven, they're definitely going to issue statements and warnings about it. So at least on my side of view, I haven't read anything yet.
If you see Dr. Gonzalez's face on TV advising you of that, or my face, take heed of that.
Okay.
If you don't see us there, that means everything's okay for now. We don't have anything factual to disseminate as per CDC. But however, we're open-minded. And if, you know, it's several things that can contribute to a variety of diseases. And I really appreciate your question. It has a lot of value. Unfortunately, one of my very close family members passed away this past Monday, and he was suffering from Alzheimer's. And I had to take a plane and fly to Orlando, where my family, my mom and my dad lived, for funeral arrangements. So I can appreciate Alzheimer's a whole lot. And Alzheimer's can take its toll on the person as it degrades itself and the family. And even after the person passes away, it still makes a tremendous impact on everyone in the family.
The article that I read was from Dr. Francisco del Valle out of El Paso, and you might want to look into that.
Humbly, I would, if you don't mind sharing that with us, we will take a look at that, and we would look into it. If not, Kayla is a great researcher too.
To try to get some more information regarding that topic, and of course source that from scholarly peer-reviewed journals that would validate that as well.
Okay, sure. And then the other thing is that several years ago, and we're talking about 10, 15 years ago, I'm in real estate, and so we were trying to figure out why there's a lot of trees that are not growing in a certain part of town. And like you said, there was a lot of agricultural around Laredo. And it turns out that in this particular spot, trees get to a certain height, the water table rises, and they're in that particular area, that's where they were dumping the oil and gasoline and extra fertilizer from the tractors in this one little area. And so it's down there somewhere, but when we have a lot of rains and the water levels rise and the trees, the roots get that and the trees die. And so
Yeah.
there's a lot of truth to what you just said.
It's really amazing what the environment, how can the environment influence your health, really? There is a book called Health and Environment, and it's really amazing. Dr. Gonzalez and I, in the past 20 years, we had the fortune to study the health effects on the people in the Fort Laredo Air Force Base that shut down in 1974 or so. And we were part of that study. Actually, with him, I was able to engineer what we were going to be testing for in the exposures that they had in the past. So even one of the models, as you had mentioned, that was used in Kelly Air Force Base in San Antonio was exactly that. The toxicologists were looking at plants and how they uprooted the contaminants, and they came out in the fruits and the leaves and stuff like that. So instead of testing humans, they just send a piece of that plant to the lab. Hey, if the plants have it, humans will have it too. So what you made, you just said, makes a lot of sense. And some of the chemicals that were used that have a long life can be persistent in the environment for a long time. Not Laredo, but like Hebronville, Duval County, and Zapata, but more Hebronville. We were asked to go help TCEQ and EPA because they were studying the exposures and the cancer rates. The cancer rates being significant in Hebronville. And that's because of the uranium mines that they had that closed down in the past, and because the cement wells they had arsenic. And arsenic and uranium are both carcinogens. So we were asked to form part of that team to identify the exposures, provide controls and prevention. So very, very, very good question.
We have another question.
Hello. My question to you, the medical staff and those who control the information, that you are more than welcome to be happy about receiving and available throughout the valley in San Antonio and everything. Your organization, do they have a security protocol for PII? And I'm sure you guys know what the PII is. Do you all have an individual that you could say, yes, the person is certified and he keeps track of our PII information? Do you even have a position throughout the city, counties, anything in Laredo that addresses that? That you want to welcome the ability to share all our information, our medical information online through your system? How do you prevent unauthorized access?
Well, actually, any provider for healthcare has to have privacy restrictions, and information is confidential. So there's a lot of information that we cannot disclose. When we are transitioning, when we were transitioning into electronic medical records, as we integrate many other aspects into it, everything has to be secured. And that's actually part of the why it's so complicated to have to reach that level that Dr. Lopez was explaining, where you can go to doctors or to LMC or to Gateway and then move with your record. We are not there yet because of specifically for the protection of PII. There's a lot that has to be done before information can be shared.
And I'm going to throw a little acronym here. In the electronic information that you do share, that you need to share, has to be HL7 compliant. And that's one of the things, the privacy, they're very tough on that. That's a good way to lose your license, a good way to compromise what you're doing. If you compromise the privacy information of any person, especially in the HIV program, that's the end of your career. Actually, in our SOP, it says that just one time that they compromise the private information from an HIV or STD patient, they're out. No questions asked. They're just fired.
Even if you're just sharing numbers, you have to have your information protected, and you have to use a specific type of system to be able to send that encrypted email or whatever way you choose to send your information, even if it's just numbers.
There's a program we had at the health department, we still have, it's called Voltage. And through Voltage, we can encrypt, it was just designed for the health system and for public health. And we were able to share with the state, for example, some information, or CDC. And then we also have another program from Microsoft that is cheaper, that provides encryption and decryption services. But not every program is really acceptable. It has to be accepted by HRSA, by CDC, and other entities that endorse these kind of things.
And to answer the question about if we do have anybody who's employed that's specifically tackling that, we actually don't. It would be great as part of the innovation of Laredo to start acquiring these individuals who are information specialists and can manage these interface software programs at a greater capacity. But we also do host information networks where we do exchange protected health information with the state, and say, for instance, with the CDC on portals such as the PHIN, which is the Public Health Information Network, that allows us to communicate with the state. Of course, that is hosted by the state, so it is covered by the state, and they're charged with ensuring that security, and as well as the National Electronic Disease Surveillance System, which we constantly have that interaction with reporting to the state, which is funneled up to the CDC. So if there is any type of notifiable disease condition that needs immediate action, we all have that information, and it is protected, and the only individuals that are privileged to that are the only individuals who have access, which is granted, not only by the National Electronic Disease Surveillance Systems from the CDC to the state, but the Protected Health Information Network from the state of Texas.
All right, so we know we've been talking about diseases and more specific items once we're already sick. But I would like to bring up the topic, and I sort of know the answer to the question because we were involved with a lot of the planning sessions at Vigo Laredo. But I do know that in your radar at the health department is the conversation about active living, not as an activity that you force yourself to do by going out and doing exercise, right? But as an activity you do every day because you have to walk here, you have to bike there. And so we get into designing streets and designing neighborhoods so that is encouraged, and we don't have the default built environment force us to use cars and then add to our sedentary lifestyle. I just want to bring it up as a topic of discussion, and I would want you guys, maybe the question would be, how active is the health department in pursuing those initiatives, and where do you see that going?
Well, I know that the health department is going to be acquiring a new grant revolving around obesity, and definitely in regards to the environmental infrastructure that would build the leisure physical activity level for the city of Laredo and the residents is coming about. But like Dr. Lopez did mention, we do have over 90 parks that are available for our residents to utilize, but it also goes back to behavioral health theories, such as the psychology of why individuals here in Laredo don't really want to engage. Or maybe it should start at a younger age where we are teaching our school-age children through operant conditioning and social psychology that they need to participate in their physical activity. We also do know that at the school districts, it is required by the education code to have 50% of their physical education attributed towards actual physical activity. But there is no really way of enforcing or taking a look at that besides the observations and the critiques by administration. But it would be good to make sure that children are actively participating in physical activity that can stimulate them to want to adopt leisure physical activity after school.
I definitely, sorry, just very quick. The health department has different programs, and it's getting even more programs with new grants that are coming. They're all promoting health, promoting active living. But one thing that I want to just comment on, our culture is based on family values. Everything that we do here, it's based on the family. So I agree with your point that that has to start from the very beginning, from the early childhood till our elderly. And it's a family approach. One example is that we have the diabetes classes, and at the health department we have Zumba classes. That group is like a family. That group, since they started, the classes were just, I believe it's 6 weeks, and after 6 weeks, that's it, they're finished. It's been years, and they're still together. They go, every time we have a Zumba class, they go together. Everywhere we go, a health fair, an activity or something, they go together, they do their exercise together, they promote it by wearing their t-shirts, by bringing other people to their group. So that's the reality that we live in, that everything has to be family oriented. So any type of active living promotion that we do, it's got to be like that to be effective.
Yes, I agree with Caleb, but I really appreciate the comment that he made, that we've gone a long ways, but we still have room for a lot of room for improvement. I think changing behaviors is the biggest challenge that we have in our community. And educating, through education, you empower people to change their lifestyles. You do that. And I think the more we keep doing that in the schools, for example, Roberto Cuellar, the LISD nutritionist, actually I nominated him for a national award, and he won. Actually, he didn't win the first time, but I kept persisting. In the second year, he won. And we're so proud of him because he's from Laredo, and he had to go to Washington, D.C. to receive the award, and they pay for everything. He instituted the school gardens in the LISD system, which also UISD also has, too. I don't want to be called to the side after this panel discussion. They also have that. But Roberto Cuellar won the award, and we're proud of him. I got about 70 pictures that I sent with the package. I really wanted Laredo to be recognized because of the work that Laredo has done. But yet, we have not reached a significant amount of the population to call it herd immunity or herd effect. Herd effect it's achieved when you immunize at least like 70% of the population. The rest of the population, 30%, receives the benefit from that 70%. So, we're looking at those things. That's a very good comment that you made. We appreciate that because we need to keep working on that to make this community healthier. That's one of the biggest challenges. We still have a challenge with diabetes, sure, with obesity and hypertension. How many of you know your BMI? How many of you have a BMI of greater than 25? I know she don't. Mine may be right at, but recently I've been exercising more, so I may be at 24.9 right now.
I just want to comment, we have four more questions, so I want to really see if we can get brief, quick answers related to, solutions that may be able to be solved through technology for the next, few. And I just want to kind of go through this quickly. I'm sorry, but we're kind of compressed on time today. Do you want to make a follow-up?
No. Well, just a closing comment about, and about behavior, just so we can all, think about that. I'll touch that when we do our panel, but it does speak to health, which is the idea isn't to force or change the behavior through education, but change the behavior through the way we build our neighborhoods and making sure that our neighborhoods are built so people can, in their daily routine, walk where they're going. I've got a watch that tracks my walking, and I can never get to my goal in Laredo But when I go, anywhere else, I reach it by half the day because things are accessible through a short walk, right? That's the...
Just along the lines of what Roger was asking, and just for the sake of my students here, I'd want to stimulate ideas for them as far as what problems the health department or the health community has that can be solved using technology, specifically in Laredo. I mean, I understand that, health records online is a big deal and that's sort of a national effort, but something that's maybe unique to Laredo that are health issues that, if you think in terms of technology and, developing a program or developing an app or maybe a website or whatever it might be, what do you think might be appropriate at this stage?
Well, currently, right now, we do have surveillance systems that we acquire data from United ISD, from LISD, and from well, not our medical providers, but from the hospitals. But we don't actually have that data real time. So it would be more efficient and effective to get that data in real time versus having them have to report it to us. So it would automatically be logged in their systems and it would just be mirrored on our side, of course, if it's a reportable condition. If it's not a reportable condition, then of course it's not part of our protocol to be investigating or wanting to probe more or wanting to help protect the community, because that's our job in public health. We want to know who might have X infectious disease so we can get in contact with that individual to help educate that individual so they can go ahead and protect themselves and their families and their surrounding peers. But then that goes back to having that information and acquiring it through surveillance systems that we don't have in Laredo, and that they're out there. They might not be effective for our system here. Since every health system is unique on its own, we would need to build something that is a little more efficient and geared towards the Laredo health system.
Would that be the person who has the disease, or would be their doctor, their health provider?
Any individual, doctors, laboratories, and hospitals are required to report by law to us, but that might take days occasionally. So we would like to have that in real time. When that laboratory result comes out, we would have it at the same time. It would just be mirrored into our system versus them taking 5, 6, 7, sometimes 28 days to report infectious diseases to our jurisdiction.
And it would be a Class B misdemeanor if any provider, any physician neglects to report to the health department a reportable health condition. CDC has initiated which conditions are reportable in the state of Texas, and they have a copy of that. So we expect for them to not only report, but report within the time frame that the protocol specifies.
With technology, it would eliminate that time frame because it would just happen instantaneously. Another question?
Hi, yeah. So I want to switch gears for a second and sort of like appeal to the scientists in you. I guess my question is something that you briefly touched on that I think is very important, which is research, specifically research here in Laredo. So I know you talked about this new laboratory sort of assignment that we're getting, but what are the research opportunities? And I'm specifically appealing to the scientists in you, and what do you think is the future for research in general throughout all science? I know this is the health panel, but I think science is something worth looking at. If we're talking about making Laredo a binational center for all these things, but science, specifically scientific research, not just in biomedicine, but also in terms of physics, math, computer science. When you're talking about all these other academic institutions throughout the world that have research centers, I mean, it's something we're looking at for the future of Laredo. So as scientists, sort of what do you see? Is there potential solutions to improve that? What do you see as the future of scientific research? Again, appealing to the scientists in both of you.
Well, just to start that off, just recently we started a partnership with Texas A&M International University to start utilizing their students to come on over to the health department to start research. So that just happened starting January. So that is a statistical master's thesis program that is happening in correlation with the epidemiology division, since we do have loads and loads of data that can be analyzed more efficiently by the softwares that the university does host. So we have already begun that approach to start inspiring the students at our local university to want to take a health approach and to maybe inspire them to not just go into a math, not just knowing that their math thesis is going to be for math only, that they can actually use that stats to come into public health or to go into any other realm of the public sector to utilize that knowledge. But in regards to actual research on the micro side, we've also approached TAMIU to start bringing in students to possibly be part of our BSL Lab 3 to do culturing and to run PCR and to know how, or to be more effective when they do reach the real world.
But actually, there is some research ongoing with the environmental health side, specifically with water. There's some, at TAMIU specifically, they do conduct research on that area. I think what we were missing would be in other infectious disease area. We don't have that. So that would be innovative if we can get them.
In partnership with the state of Texas, Department of State Health Services, we have an ongoing research for microorganisms that are not common. And I don't want to scare you, but we're finding microorganisms that are resistant to medication in the hospitals and in adult daycare centers and stuff like that. This is ongoing. We have been at it for the past couple of years, and it's really getting intensive. These microorganisms have names that you cannot even pronounce with your lips. You know, they have complicated names that, you know, it's not like salmonellosis, you know. These are really unique organisms. So this is ongoing research as to, in the TB field, tuberculosis, we have ongoing research right now. We have a strain of tuberculosis that is very specific to Laredo. Nothing to be proud of, but, you know, there is. It has been identified. We have been doing molecular epidemiology and DNA testing. And the studies are ongoing, but not only by ourselves, but in partnership with the state of Texas, CDC, and also the colleges and universities that we partner with too. So that's a very important comment. Should we be doing more? Yes. We want to be doing more. I agree with you. There's a lot of room for improvement for doing more research. We want to be recognized as a research hub, a binational research hub for both the U.S. and Mexico.
So just to conclude on that, the research opportunities are there. We just need more youth and more individuals who are inspired to want to take part of it with us at Public Health.
And we're going to just ask, last question, if only one person could answer in maybe 30 seconds and a minute, please. And then we're going to move on to the housing. And apologize for everyone for extending the time.
I just wanted to ask, I mean, I'm part of the initiative that's happening at Canseco House, and we went to the Mark Winnie thing, and active living and education by empowerment, or empowerment by education. But if you had to pick one thing as far as technologically, how you could see technology helping either community gardens, the school systems, or the city health department, what would you like seeing done? Either information, technology, an app, something on the website? How do you see technology helping education and wellness and active living?
30 seconds. I'll talk forever.
Now.
We have an app right now in partnership with CDC and the University of Arizona. And I had to go to Arizona a month ago to meet with them. And we have an app that is called Cadenga. That one keeps track of symptoms and syndromes that people can log in. We'll give you the address afterwards. But you can access that through your mobile phone, through the Apple Store, download it and use it. I think similarly, there's room for improvement into having interactive electronic communication with the community through apps, through more social media, through exchanges, through special chats that we could have online to have free advice and information to the public. And the public will, you know, make it easy on people. We want to promote community gardens. We want to promote the Canseco. It's really important to public health because Canseco, it would be the model that the rest of the community can follow too. I don't know if you know where Canseco is, but this Canseco building was owned by a doctor of medicine many, many years ago. He's not alive. And he is on Chihuahua Street, right? And if you happen to drive by, it will catch your attention, that building. Many, many years ago, I said, I wish I had enough money to buy that building and keep it for myself. And in the basement of that building, this physician used to cure people in the Laredo community. So there may be ghosts, but good ghosts in there. But Canseco, yes, it's the symbol and the icon right now of community health. And we depend on that, and we thank you and the team for being involved with that, because I even seen the church division, I guess, being involved with that, and they're involved with providing food for the elderly, and they're going to have a food pantry downtown in that Hamilton building. So all of that it's together, but we need to work at it more together and to integrate everything that we have in Laredo together to provide the services so that everyone knows what we have. We need to spread the word so that people
which
can
would be
take more
done via
conscious.
technology, and that's what we would like to do is start a program such as the HQ app. I don't know if you all are familiar with the HQ app that pops up on your phone to send out messages to everybody, to get to your phone, to give you health alerts, to give you the information the basic information that you would like. But unfortunately, we don't have a studio like this. We would like to, and we don't have the application to jump in front of you on your phones and get those messages out that is required to sustain healthier lives. Thank you all.
Thank you.